The two videos, Principles of Oral and Maxillofacial Radiology, include a total of 8 lectures. The first video includes basic information every dental assistant should know about the production of X-rays and the X-ray image. The second video serves to acquaint you with what is seen in the radiographic image. While this information is not necessary for you to know, it will allow you to see what the dentist requires in a radiographic image. The radiographic image is one of the lectures in this series. You may view this free lecture for your own assessment as to quality and content. Students of dental assisting will find the complete series, including all 8 lectures, will both serve the curriculum and be helpful for review prior to a certification examination. The photographic properties of the radiographic image are described by the terms density and contrast. Radiographic density refers to the overall degree of darkening of an exposed and processed radiographic image. Radiographic contrast refers to the difference in density between adjacent areas within the radiographic image. Image density may be influenced by the several factors affecting X-ray quantity or the number of X-rays. However, clinically, the primary factor used to control density is the exposure time. This is because a change in exposure time results in a corresponding change in X-ray quantity and image density. That is to say, if the exposure time were to be doubled, the radiographic image would be twice as dark. Likewise, if the exposure time were decreased by 1/2, image density would be half as dark. Images with high density are described as dark images. Images with low density are described as light images. Images viewed on a computer screen may also be described as having low brightness or high brightness. While the term image density refers to the overall degree of darkening of an exposed and processed radiographic image, density differences seen within the radiographic image are described by the terms radiolucent and radiopaque. Radiolucent is a term given to the relatively dark areas in a radiographic image. Radiolucent areas in radiographic images represent areas in the object of relatively lesser thickness or physical density. These areas allow relatively more X-rays to pass and strike the image receptor. The arrow is pointing to the radiolucent image of the tooth's pulp. Radiopaque is the term given to the relatively light areas in a radiographic image. Radiopaque areas in radiographic images represent areas in the object of relatively greater thickness or physical density. These areas allow relatively fewer X-rays to pass and strike the image receptor. This arrow is pointing to the radiopaque image of a metallic restoration. The terms radiolucent and radiopaque are described relative to one another. In this image, dentin may be described as radiopaque relative to pulp because the image of dentin is lighter than the image of pulp. However, dentin may also be described as radiolucent relative to tooth enamel because the image of dentin is darker than that of enamel. To watch the complete video, go to MediaMedent.com, scroll down to Free Lectures, and select the corresponding video.